Dr. Hawary, I'd like to talk a little bit about, I want you to explain to me what's the difference between a veneer and a lumineer. To me, they are both kind of clip-on fingernails, just that they clip on the tooth. But tell us, the patients, a little bit what's the difference, because there's those words swirling around, and nobody knows what one is and what the other one is, and what are they used for?
The veneers, in a very simple definition, are very thin laminate of porcelain that added to the teeth. Now, nature has a lot of natural colors and effects that goes into that. With lumineers, it's more like a thicker layer that doesn't have a lot of internal colors built into it, but have more of outer stains that doesn't give the same exact natural depth and effects of natural color, like if a veneer is built from the inside out with the porcelain. So a veneer, especially what we call a feldspathic veneer, it's a veneer made of a paste that is layered and has a lot of colors, and it's an artistry. If a dental technician is very good at it, he can mimic nature very well through that.
I see. So, all right. So are you telling me a veneer is better than a lumineer? And what's the difference? Or is it used for the basic same thing? Just one is a lower quality than another one, or explain that to me.
Yeah, veneers can be done in many different ways. As I mentioned, the most natural way, the most natural looking one is the one that is layered and built from the inside out with a lot of colors. Can be they used to the same thing? Yes, they can be used to the same thing, but the result is not the same. One is very natural and can be very thin, and one can be a little bit bulkier and more of an opaquer, monochromatic, which means one color kind of thing, which teeth in nature don't have that kind of look. So they can make the teeth whiter, they can make them longer, they can close spaces, they can correct misalignment. All of that can be done, but the outcome is completely different between a layered veneer made of pure glass versus a lumineer that is more of an opaquer look when it comes to the end result.
I see. So a lumineer, not quite so good. Now, however, so I got it in terms of looks. And that's of course super important. What lots of people, however, what doctors say that one of the advantages of a lumineer is that you don't need to grind the tooth down, and with the veneer you do need to grind the tooth. Is that true?
It's not very true, because it depends on the alignment of the teeth. If you put lumineers or veneers on top of misaligned teeth that are out of alignment, meaning overlapping each other or something like that, you have to do some kind of
grinding,
preparing the teeth to accept a straight alignment.
I see. So in both cases, depends on what it is, how the tooth is placed, and what you want to achieve with the tooth. You might have to do some grinding anyway.
The grinding here is basically is very minimal. The enamel is very thick, and the reason that we do that, because we want to give at the very end the most natural look to the veneer, because we want to give the smile and the teeth the health of, the natural thickness that nature provides. We don't want a layer on top of another layer, very similar to an acrylic fake nail of women that is much thicker than natural nail. In teeth, if the teeth are much thicker than the natural teeth, even though, hypothetically they look okay, the gum would not like that, and there would be a lot of gum inflammation with that as well. However, if we remove very bare minimum, very conservative amount of reduction, which won't affect the teeth, but with a very thin veneer to substitute whatever we removed of the tooth, the end result would look much more natural, and the gum would like that much more. At a very high level of doing cosmetic work, there should be some very bare minimum of teeth removal, except in a very, very rare cases. But in most of the cases where the teeth are misaligned or deeply discolored, there should be enough thickness to allow a natural looking teeth as well.
I see. So what you're saying, Hawary, is that the little bit of grinding which is needed, or let me say it this way, the little bit of grinding which might possibly be avoided with a Lumineer does not offset the beauty and does not offset the fact that you don't want a more bulkier tooth, which happens with a Lumineer, which then might irritate your gums, and the gums don't like it. It doesn't offset it. So a veneer in most cases, or in your opinion, it looks like in almost all cases, is a better way to go.
Absolutely.
Okay. And on an average, would those veneers be costing a lot more than a Lumineer, or is it relatively a washout, or are we, really not talking major differences?
No, I think the cost, basically it's the difference in the lab, and here if we want to get a very high-end lab doing a very fine natural looking teeth, they ask for a certain price. Does not necessarily mean that there's a much higher than Lumineer. It just you get what you pay for, and with a natural looking veneer, most people are very happy, and they like to redo things or change it or feel that it's not the right choice, which I have experience in my practice. Doing the best quality is the best way to make patients happy. And when it comes to veneers, I think building the teeth and layering the veneers is the best way to go.
Okay, thank you very much.